I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida, to discuss how to deal with children with bipolar disease. I like to refer to bipolar disease in a more accurate way, which would be bipolar disorder. For years, we didn't tend to diagnose children with bipolar disorder. We didn't tend to see this disorder develop its onset until latter adolescence or early adulthood. But in latter years, we've been recognizing that bipolar disorder can be diagnosed with children in a much earlier age. The problem that's been historically with diagnosing children with bipolar disorder is because it was oftentimes confused with attention deficit, hyperactivity, conduct disorder, as well as childhood depression. So oftentimes we focus more on those disorders as opposed to the bipolar disorder. Now, how to deal with children with disorders, because it is a medical condition, a psychiatric condition, it's important to work very closely with your physician or child psychiatrist, and not only in a medication regime, but in a behavioral regime. Remember that bipolar, often historically known as manic depression, is a disturbance of mood. So oftentimes how that mood is displayed with children is much different than it is with adults. Oftentimes with children you'll see a lot of acting out type behaviors. And so it's extremely important to understand what drives that acting out and what you can do as a parent to be able to cope more effectively in the best interest of your child. And again, in dealing with childhood bipolar disorder, extremely important to work closely with your psychiatrist or physician, and not just the medicine, but as well as the therapy or cognitive behavior piece of dealing with this disorder. I hope this information has been helpful regarding dealing with childhood bipolar disorder. From Tampa, Florida, I'm Dr. David Thomas.